So welcome back, ladies and gentlemen. I am privileged to have Dr. Navaneetha Rao with us today. Dr. Navaneetha Rao is a seasoned, R&D guy who has been located in US, and today he will be presenting to us, a very unique topic, which is like notable triumphs, missteps, lessons learned, during these COVID times. Uh, as you may imagine, his work experience not only spans basic research and drug development, but also includes organization building and being an entrepreneur. He has over 25 years of experience in diverse fields such as dairy, food science, physiology, cell biology, public health, and drug development. He has held senior level drug development, scientist roles with international experience and expertise in early stage clinical development of multiple technologies, gene transfer, cell transfer, therapeutic proteins, all these MABs, small molecules, and also generics. He has been addressing serious unmet medical needs across multiple therapeutic areas, for example, cardiology, oncology, infectious disease, hemolytic and thrombogenic disorders. So I think with this intro, I would like to present the stage to Dr. Rao. We are privileged, sir, that you were here with us today. And I would also share my screen. I will put off my video and audio out, but whenever you need to have the screen, you can just tell me. Okay, so over to you, Dr. Rao.
Thank you very much for that very kind introduction, Kuntal. You've been very kind and generous with your words. But it's a privilege and honor to speak to you all today. And it's a very broad topic. And upfront, I can confess I won't be able to do even minimal justice to any one of those words that are on the title slide. But I'll give you a panoramic view of what has happened in the last 12 months or so, and address some of the challenges and the dilemmas that we have faced, but end with a note of optimism and what we can accomplish if we put our minds to it. So if I could have the first slide, please. So this slide sort of captures in a very, I think, a succinct manner, the assault that has happened to all of us in the last year or so, because the assault has been simultaneous, it has been multidimensional, and it has not been just international, it's been global. I don't think such a crisis humankind has faced in a very long time. So let's address each of these at a high level. So the three things that I want to touch upon very briefly are the concurrent assault on health, economy, and liberty. Much of my talk will focus on health because that's what I know a little bit about. I know hardly anything about economy other than using up the money that my wife makes. And I'm a very devout proponent of liberty. Let's take health first. As far as COVID is concerned, at the most recent count, we're somewhere in the ballpark of about 120 million cases. That is just a numeric, right? But what really has a bigger impact is overall deaths. We have about 2.6 million deaths so far around the world because of COVID. And this is as of earlier this week, I think. But to put this in context, I would draw your attention to the 55 million deaths that occur across the world per year. So 2.6 million for COVID, 55 million overall, all indications per year. Much of that 55 million is primarily cardiovascular and oncology. As I pointed out, this cardiovascular is about 17.6 million of the 55 million. So I just wanted to give you that statistic, sort of put some things in context. And I'll weave this as a theme across my conversation. But in addition to these deaths, there's been a tremendous collateral damage, which is, at least in the US, the estimate is that there's a 40% addition to this in terms of the overall death. In addition to the mortality of this affliction, we have the assault on mental health across demographies, across societies, has been tremendous. And it's only now being understood in terms of what profound residual effects this will have, enduring effects this will have. And we can pick up this in the question and answer session if time allows. And other conditions. By other conditions, I mean, in one way, how COVID has exacerbated underlying pathologies, as well as because of the restrictions imposed during COVID, how decrease in care has resulted in additional disease burden across the world. This goes across, cancer, it goes across cardiovascular, et cetera, et cetera, et cetera. Again, we can pick this up during the question and answer session if time allows. The second circle I want to talk about is liberty. We've all been talked about. I really will not. I'll try to avoid getting into the politics of these things, but I think we need to be mindful that these mandates, be it number of people associated their own homes, whether you wear a mask or not, where you go, etc., has been very crippling, and has a big effect. So these mandates, various kinds of travel restrictions, and compromised confidentiality. And as I said, I don't like even my wife knowing where I'm going. So why the heck should I agree to where the government knowing, regardless who the government is, as to where I'm going? So there's a big assault on liberty, and we have to be mindful of that. But having said that, without these mandates and without these restrictions, we would have been in a much worse shape than we are today. And of course, the big thing, other big circle is the economy. The numbers that I've shown there are primarily reflective of what happens in the US. I didn't have the time, nor do I have the knowledge to see what happens across the world. It would have been too much. In the US itself, let me read out the numbers, because I think it's really, really important to keep this in mind. The CBO estimates that the loss in the next decade because of COVID is $7.6 trillion. That's trillion with a T. I don't even know how to think of that. I can't think about $1,000. I don't know how to think about $1 trillion. The consequence of there are additional sub layers to this. In addition to that, the economic impact, because of premature deaths that I talked about just a short while back, is over $4 trillion. Again, trillion with a T. The third aspect is there's something called quality of life disutility. That is because of these pathologies, even if you don't pass, it has a huge negative impact on one's productivity. If you combine all of that, that itself amounts to over $2.5 trillion. The total of this is about 90% of the country's GDP, just because of this virus and how we have responded inadequately to this pathogen. So this sets the stage for much of what I'm going to say next. Right? Next slide, please. So this is just showing a heat map of the deaths across the world. I've just picked up a few different countries there. I don't want you to, I will not obviously go into each situation in each of the countries, but you can see that the left part of the curve is when this first started becoming a problem. It shows the first wave, so to speak. The boxes to the right of the slide shows what's happening currently, right? And the more red the box is, the more dire the circumstance. I will not again go through the complete heat map, but you can probably see 3 red dots there. And with my poor vision, even I can't see those countries, but I'll speak to them. The first red dot is the United States. You can see the huge red spots both at the first peak and on the ongoing peak. The second 2 dots are counterexamples, or examples that present to the contrary, which is in South Korea and Taiwan. The reason I bring that up is if you see those 2 countries, you'll see very little red. Very little red. And we can talk about this because it illustrates a fundamental issue in terms of how we deal with the pandemic. And I'm a public health person. That's why I can speak at some length about this, but let's defer the questions as such to the question and answer session if time permits. But the main point I want to make here is there was a much more effective way in which we could have dealt with this pathogen. And unfortunately, in the United States, we did not. I don't have the ability to speak about what's happening in the rest of the world. I can talk about the US and I can talk some about India, but I think this illustrates how inept management of a pandemic results in consequences that are profound, and it behooves us to do things right. Next slide, please. But I want to spend a bunch of my time in some of the major triumphs, in spite of the 90% decimation of a GDP, but we still accomplish great things. I highlight some of the things here. And the main theme here is science can, if you let science free, deliver. And for me, that's amazingly refreshing. All right, what are some of the things it's done? We have learned so much in terms of improved patient management and outcomes. All of us remember the horrific scenes from streets of New York and Italy about what was happening. You don't see that in the second peak because we've learned how to deal with it. We know how to manage these crises, the health crises. The second is the improved therapeutic interventions, both in terms of vaccines, on which I'll spend some additional time in subsequent slides, and various therapeutics. Therapeutics including novel entities as well as repurpose opportunities. Repurposing is a big soapbox of mine, but again, if time permits, we can address that in the question and answer session. The third point is amazing regulatory nimbleness and adaptability. It's just, I worked with FDA. I actually have a high regard for the agency. I really have a very high regard for the agency, and they've been extremely nimble. And the number of EUAs that they've issued is really interesting. But as interesting as issuing those authorizations have been their withdrawals. For chloroquine being an example, notable example. Again, we can talk about any of these things if time permits later on. And the international collaboration that has happened, including between competitors, for goodness sake. Merck collaborating with Johnson & Johnson. I mean, how many times do you see that happening? And look what's happening with the vaccine story in India right now. Serum Institute is making a vaccine developed by Oxford and AstraZeneca. There are many, many such examples, and it's just fantastic. And it's really refreshing. A big thing when I was growing up, I always wanted to be a physicist, but I ended up being a biologist. But for somebody with that kind of a background, for me to see the rover landing on the surface of Mars in February was chillingly fascinating. And it's amazing as to how NASA has accomplished this. In parallel, what Elon Musk and his team has achieved in SpaceX. All of this happened during this crisis. And I know some of the people who were working on the rover mission with NASA, they couldn't meet. One of my people I know who was involved in that mission, she needed to come to NASA in Houston, but she could not. She was in California, coordinating these things, online. We've done accomplished amazing things in spite of the crisis. So this also speaks to the resilience that came about, and one of the that we demonstrated during this year. And again, I don't have much time to talk about Operation Warp Speed, but it was an amazing way in which the government responded to bring things out at warp speed, and at warp speed some of the things have been delivered. Next slide, please. So here I just want to give a very high level overview of some of the things that we have learned in terms of how to manage patients with serious symptoms and when they're hospitalized. Again, I will not get too much into the details of this because, again, if we have time, we can talk about it. The main points I want to make here is we know now that the early stages of the illness and the mildest stages is primarily a pathology driven by the virus. So medical intervention, therapeutic interventions that that are directed against the pathogen are likely to be a lot more effective. Remdesivir being an example, a repurposed drug, by the way. Whereas in the latter stages of the disease, or when the symptoms are much more severe, it's unlikely that the antiviral is going to be much use because it's a host response that is driving the pathology, in which case you need to focus on inflammation, coagulation, and related pathologies. And that is where things like anti-inflammatories come into play. And Okay, again, I have a lot of things to say about it. If we have time, we can discuss in the next question, during the question and answer session. Next slide, please. This shows a very interesting overview of what happens to what the risks of hospitalization or deaths are if somebody tests COVID positive. The different lines are, I can't see the slide very clearly here. It is basically, I think, it is men versus women, shown red and black. And the solid lines, I think, represent people without any other comorbidities, whereas the dashed lines show what happens if they have any of the multiple comorbidities that are listed. Because of this, we know now how we can triage the patients, how we can manage the patients, and this, all of this has happened in less than a year. If I remember having been in another such meeting of lots of experts, and they made an interesting comment. Typically, in modern world, the life cycle of medical changes is very rapid, but it takes at least about 2 to 3 years after everything has been done. For example, if a new drug is approved, everybody says it's the next golden thing. By the time it comes into common practice, it's about 2 to 3 years. In the COVID era, especially in the early stage sciences, the joke was the half-life of new knowledge in the COVID era was in a matter of days, if not hours. It's amazing, right? Next slide, please. This slide reflects what I just said in terms of the amazing and extensive amount of work that's been done. When I clicked on clinicaltrials.gov yesterday, there were over 5,000 clinical studies that were listed on clinicaltrials.gov just for COVID. Okay, I didn't put any of the other associated words. All I put in the search term was COVID-19. There were over 5,000 clinical studies. All of us who are in clinical development, just have to be amazed at this thing, right? And look at the number of drugs in the pipeline. There are over 688 preclinical candidates, and there are 5,000 clinical studies. This is amazing, right? And the learnings that is going to come from this is going to have has going to beneficial effect across disease spectrum, because again, as we talked about, the latter stages of the pathology is primarily inflammatory and coagulopathies. And many of our current pathologies are driven by dysregulated inflammatory responses or immune responses. So the learning from this is going to be phenomenal and is going to be translational to a variety of indications across the disease spectrum. And I think this is, again, something that we need to be very proud about. Next slide, please. Again, I will not get into too many of the details regarding this, but I want to underscore the following points. In fact, I've been on record in one of my podcasts saying that the earliest that we can think about a vaccine coming into play was 18 months. This was sometime in April of last year. I've already got my second shot of the Moderna vaccine. Amazing. Just unheard of. We need to celebrate this. And, over, I would say, 500,000. Again, I cannot speak about what's happened with the Sputnik vaccine. I cannot speak about what's happened with the China-developed vaccines. But just the vaccines that we really know about, over 500,000 people have been enrolled in these studies. Our hats off to the participants who volunteered themselves to participate in these studies, and the system that enabled so many hundreds of thousands of people to be enrolled in such studies. Again, I do clinical studies. We all know how difficult it is to enroll a participant and follow it through completion. This is, again, just amazing. The second point I want to make here is, I think Kuntal was kind enough in his introduction to mention gene transfer and gene therapy. what you see here about both the mRNA-based vaccines as well as the adenoviral vaccines is a result of what was being done about 25, 30 years back. I still remember when we were doing the first gene transfer study in patients with advanced cardiac disease, we were talking to the FDA almost on a daily basis because the FDA didn't know how to regulate such a novel products. So my learning was 90 degrees at the time, but that has now come to fruition. Right? This not just happened as I said. It's just amazing that all of these things have happened in 9 months. But it's just not happened in 9 months from start to finish. This is the result of 20 years of labor and a lot of fascinating work that's undergirds this development, this progress. Next slide, please. Not only have we developed vaccines, we have vaccinated people. So, again, I've been on record saying, it's a very different thing going from a vaccine to a vaccination, to a vial to a shot. What's happening? Look at what's happening primarily in the US. We have inoculated about 22% of our adult population has already had the first dose. And I think we're on record to go, I think President Biden has said 100 million people, 100 million shots have already been administered. And, we may likely hit the goal of everybody who wants a vaccine to get it by June. It's, again, another milestone. But I want to also contrast it what's happening in South Asia and Africa, where it's not happening. We're just not seeing the vaccinations pick up. But hopefully, with India now ramping up, those numbers will also go up. Next slide, please. Again, we were talking about clinical trials, right? There was a complete pause in these clinical trials during April, May last year. And this has serious consequences because if we don't have trials, we're not getting better products, we're not understanding medicine, we're not understanding how better to deal with our patients. There's a big shutdown in many of those trials, but there's been a much bigger recovery. There's been a profound recovery already happening. And the primary reasons for that are how nimble the entire ecosystem has been in terms of using digital technologies, mobile-based technologies, virtual trial virtualization, which is all listed in the left part of the slide, and tremendous regulatory support. Again, let's go back to the vaccine, which also applies here. Typically, drug development has been a very sequential process. It's important to understand that the vaccines have been developed and other modalities have been developed not by cutting corners, but by being a lot more risk accepting and doing things concurrently. And the de-risking of from the financial end was again a primary result of Operation Warp Speed, where the system absorbed some of the financial risk of the innovators who were then willing to do the things concurrently as opposed to sequential manner. And we see the benefits of that. Next slide, please. Look at again the number of drug approvals. We have in much of the FDA has been focused on looking at COVID management, but they have not slackened at all in terms of the other indications. We are on track to have the record number of approvals of new molecular entities in 2020, where it only, I think in 2016 or 2017, did we have more approvals than the past. So this again is amazing. It speaks to the resilience and adaptability of the system. Next slide, please. I'm going to rush through now because I'm looking at my clock. We don't have much time. For me, this is just fantastic. I still remember giving a talk over 10 years back at, I think, Bangalore Bio, if I'm not mistaken. And I was talking to them about Moore's Law. And Bangalore people, of course, understand Moore's Law. And I was talking to them about the reverse of Moore that applies to those of us in drug development. And we actually might be on the cusp of reversing Moore's Law, the reverse Moore's Law, which is called the IRUM now. And again, if that happens, it's fantastic. And shown in the left are some of the reasons why this might be possible. Next slide, please. I don't think I have too much time, so I'll leave this slide for you, and I'm sure Kuntal will share it with you all. I think this is, again, very illustrative in terms of the kind of nimbleness the industry has shown in terms of the kinds of collaborations they want to involve in, the kinds of funding sourcing that they want to access for promoting and facilitating innovation. Next slide, please. Let me end with this quick. I know I rushed through the last few slides, but I was looking at my clock. It's 9:41 already here. So let me end this slide by saying namaskara. I'm from Bangalore. That's the way we say thank you. I appreciate this opportunity that you've given me. But I also want to end with a quote, and in deference to our host from Germany. And this quote is actually printed on all of the National Academy publications. And I think it's a very important quote, and I think very salient to our discussions today. I'll read it out. Knowing is not enough. We must apply. Willing is not enough. We must do. So let us rededicate as ourselves individually and collectively to both applying and to doing and to making this world a better place. Thank you.
Thank you, Dr. Rao. I think this was really, very, very interesting. There are already, as you know, there are a few questions coming because I think all the viewers have a lot of questions. So I will read out two questions which came from, the previous speaker itself, Abhijit Kelkar. He was speaking just before you. He's based out of London. So he was just a speaker before you. So he is asking, how many of clinical studies on COVID are therapeutic studies and how many are immunity studies? So if you know.
Sorry, I didn't. I wanted to get that breakdown, Kuntal. I didn't have the time to get
No
that. I
problem.
will.
No
I
problem.
will answer that question for Vijay later on.
Okay. And then, of course, another question which is also controversial. You may answer, you may not. He's asking which of the vaccines that are yet not launched look most promising.
I don't know the. I don't. The answer is not known to that, right? And even the vaccines that are developed. Okay, let me say, none of the vaccines have been approved, formally approved anywhere. They've only been authorized. So data is being gathered even as we speak. And okay, you asked me a question. Let me even the authorized vaccines, right? People throw around terms like 94% efficacy, 84% efficient. We got to pause there. It is a tyranny of small numbers.
Correct.
Okay, what do I mean by that? Again, I participated in the advisory committee meetings of all the vaccines that have been authorized here. If you look at the numbers overall, Kuntal, as I said, just for argument's sake, say 40,000 participants in the phase 3 study. I mean, the numbers are plus minus whatever, but that's you get a trend. The event rate is about 200. So you're seeing 200 events in the placebo arm. You're seeing 8 events in the treatment arm. That's fantastic. But that comes from a base of 40,000 participants. Right? So small changes in the number here and there can have a huge impact on this. So it's a tyranny of small numbers, number one. That presents you the challenge of doing vaccine studies. It's really not trivial at all. The second thing, we know nothing about how enduring the immunity is.
Correct.
Third, we don't know whether it is neutralizing immunity or not. I.e., today, it's highly likely that I'm protected from serious COVID-related pathologies if I were to get COVID. But if I go to Bangalore, and when I go to Bangalore, there is no guarantee that I have neutralizing immunity such that I won't be able to transmit this to my 90-year-old father.
Correct.
Right?
Correct.
So it's, as a public health person, I'm still going to wear my mask.
Absolutely. Yeah.
Right? So
no, I think that's the new. Yeah. True.
Yeah, we've got to be mindful about all of these things, right? And this again underscores, I didn't bring this about Kuntal in the talk because it's too complicated. I think this really underscores the importance of all of us engaged in science to engage ourselves with the public and not work in silos and not let noise boxes and media people who are beholden to one particular viewpoint to be the ones who are conveying this message.
Correct. No, I think I am following that for quite long, as do you. I think you are much more experienced. I have seen that, mostly the clinical trials were being done in China. When this, COVID hit, then, there was a big discussion, oh, what will happen? And so there was a global exercise, a consortium was formed,
Hmm.
about reprioritization, reformatting. It's
Yeah,
pretty much like putting the car engines, and taking the supplies out of the world in this hub,
right,
and
right,
that has never been done before. So I think
correct.
COVID has also taught us a great lesson, of
Absolutely, absolutely,
prioritizing.
absolutely. And in one of the slides that I had, I didn't have time to discuss that, Kuntal. I talked about the challenges that we face in spite of the
Yeah,
challenges things that we did. Right in the U.S., we were hit with an additional challenge, which is a very, very constitutional challenge. We had an election, a contested election. The country survived.
correct.
Right. I mean, take a pause. Can you imagine what would have happened to both the U.S. and thereby to the world if the consequences of January 6th were somewhat different?
Correct. Correct.
Second, not only did we have a contested election in a highly contentious period, we had. So I came to this country in 1985. I've never seen the kinds of racial unrest across the country. But in spite of that, we prevailed. That speaks to the resilience of the institutions, the systems, and the people.
Correct. No, I think that's the good part. I think, overall, as a community, I always speak about that. As a community, global community, I think we have all evolved, what we
Correct.
were there in March 2019 and March 2020, and sorry, 20 and 21.
Right.
1 year has taught us many things, amongst all, how to develop, how to prioritize. And of course,
Right.
there are nasal vaccines and all that is coming,
Yeah.
in
Yeah.
future.
Yeah. Yeah. Yeah.
So
Yeah.
I am
Yeah.
interested to look at it.
Absolutely.
So I
Absolutely.
personally feel that you have such a vast experience that it's not enough to have you only for one conference, Dr. Rao. So we would be really delighted to have you again in the November one. And I think, of course, by that time, as you might have realized, we are also moving towards a mentoring platform.
Ah.
So I think
Okay.
there will be enough opportunities to to stay in touch, keeping in touch, and really have you in any other future sessions. It will be our
You're very
privilege.
kind, Kuntal. Thanks for this opportunity. And I also, if Dinesh is online, I need to say thanks to Dinesh for introducing the two of us.
Thank you, Dinesh. Yeah, thank you so much.